This teaching video about the treatment of ectopic pregnancy is meant for medical students. Who are the candidates for surgical management of ectopic pregnancy? The presence of any one of these is an indication for surgery. Hemodynamic instability or features of rupture of ectopic mass, pelvic or abdominal pain, or presence of intraperitoneal bleeding on ultrasound. Surgery is necessary when there is an absolute contraindication to medical management. In the presence of relative contraindications, you may consider surgical treatment. Another indication for surgical management is heterotopic pregnancy, because presence of a viable intrauterine pregnancy is an absolute contraindication for methotrexate treatment. Most ectopic pregnancies, even in the presence of hemoperitoneum, may be treated using a laparoscopic procedure. However, for patients with acute bleeding, some surgeons prefer laparotomy. This laparoscopic procedure may be either salpingectomy or salpingostomy. In salpingectomy, the part or all of the affected fallopian tube is removed, whereas in salpingostomy, the ectopic pregnancy is removed while leaving the affected fallopian tube in situ. Laparotomy is indicated in three clinical situations. 1. Hemodynamically unstable patients. 2. When there is large amounts of intraperitoneal bleeding on ultrasound. And 3. When visualization has been compromised at laparoscopy. Then laparoscopy procedure may need to be converted to laparotomy. When is surgical intervention performed in hemodynamically stable patients? Surgical intervention is indicated only if transvaginal ultrasound shows a tubal ectopic pregnancy or an adnexal mass. If no mass is visualized sonographically, then a tubal pregnancy will not usually be seen or palpated at surgery, and the surgery may turn out to be unnecessary or unsuccessful. Such a clinical scenario may occur in three clinical situations. 1. In early gestations, when the ectopic pregnancy is small. And 2. The pregnancy is actually intrauterine but abnormal. Or when the ectopic is at another site, that is not in the tube but somewhere else. These patients should be managed conservatively, that is either with methotrexate or expectant management. Repeat the ultrasound after a few days. Then an abnormality may be visualized, and then a surgical procedure may be considered if needed. Which is the preferred surgical treatment? Is it salpingectomy or salpingostomy? Salpingectomy is removal of the whole fallopian tube, whereas salpingostomy is just incising the tube to remove the tubal gestation but leaving the remainder of the tube intact. Salpingostomy is the preferred surgical option because this is the conservative surgery. As much as possible of the tube is retained. What are the indications for salpingectomy? 1. Ruptured or damaged tube. If the tube is moderately or severely damaged, there is no point in leaving behind such a tube. 2. Uncontrolled tubal bleeding. 3. If the tubal ectopic is too large to be removed by salpingostomy, if the mass is more than 3 centimeters. And finally, bilateral salpingectomy may be done as a way of permanent sterilization for patients who have completed childbearing. How is interstitial pregnancy managed? An interstitial pregnancy is implanted in the interstitial portion of the fallopian tube, that is, the proximal segment within the muscular wall of the uterus. More than 95% of ectopic pregnancies are found in the fallopian tube. The most common site is the ambula, about 80%. 12% occur in the isthmus, that is here. And then about 5% are seen in the fimbrial end of the fallopian tube. Just 2% of cases occur in the interstitial portion of the tube. The interstitial portion of the fallopian tube can dilate more readily than other portions of the tube. Therefore, the pain usually presents later in gestation, between 8 and 10 weeks. In those patients in whom medical treatment is appropriate, multiple dose methotrexate should be the initial therapy. Surgical therapy is indicated if there is any deterioration in clinical status. In those with increasing abdominal pain, consider early surgical intervention. Laparoscopic cornostomy is the preferred surgery, that is removal of the interstitial pregnancy. Corneal resection, that is resection of the interstitial portion of the tube, is done if necessary.